30 participants. Fantastic. So we're all good to go? Oh, there's a few more coming in.
Yeah, let's give them a couple of more minutes.
Sure.
Yeah. I think one of them might be having technical issues. I'll message.
I think so. Prita or, yeah, that's right.
I'll just message her. Sometimes Zoom is weird. Okay. Hi, everybody. Are you excited for your completion ceremony?
Oh, lots of hearts. That's good. A cascade of love.
Good morning, everyone. Yeah.
Chris, I think it should be fine. I'll just message the rest who are still not here.
Sure.
Thanks.
Well, kia ora koutou, and welcome everybody to our final day together. And it's so good for you to be here. I understand that yesterday's session went exceptionally well, and that you learned a lot from Colin and Foot. So that's really great. I'm pleased to hear it. So we've got two great guest presenters today to wrap up our teaching, and then we're going to have a little break between about for half an hour once the second presenter has completed. That's Foot, who you heard from yesterday, and then we'll come back for your completion ceremony. But before we proceed any further, let's open our session with an opening karakia. E te atua manaki mai I mātou I roto I tēnei hui huinga he ako he maramatanga amene. God bless us in our gathering for learning and understanding. Okay, all right. So it gives me really great pleasure to welcome you all back to the session today, and to introduce you to Dr. Noah Bunkley, who's a public health doctor, and he's officially now a public health specialist, having passed his final examination not more than about a week ago now. So congratulations. And Noah's doing his PhD with me and Sir Colin, who you met yesterday. And he is working in the field of global health, and specifically in climate change. So he's going to take you through a session on that, and then Put is going to put his angle and perspective on global health challenges before we wrap up and have our break at about 3:45. So Noah, welcome. Thank you very much for your time. Noah's at a conference in Wellington right now, so he's giving us this precious time, and really appreciate it, Noah. So over to you. Thank you so much.
Thank you for the kind introductions, Chris. My internet seems to be pretty good at the moment, and I hope it stays that way. But I am in my hotel room, so we'll just see how we go. I believe I've got about 40 minutes, so I'll see how far I can get through in that time. It's a pleasure to be here to present. As Chris said, I am a public health doctor and doing my PhD through the University of Auckland with supervision from Chris and Colin. So I will also try to monitor the chat, so feel free to add any comments or questions into the chat while I go through, or raise your hand if you've got any questions at any point. Happy to make this a bit more of a discussion than a didactic teaching session. There will be some questions as we go through. So I'll be covering global health today, basically trying to gather a bit of an understanding of what global health is, start a little bit of a discussion around the global determinants of health, and then finish with a case study based on my research on climate change and heat in the Pacific. Again, we'll see how much we can get through in the time, but we'll just see how we go. So to start with, what is global health? Global health is a very big term. It's a big idea. Let's just start off with, does anybody have any ideas or a definition that they like to use for understanding what global health means to you? Feel free to shout out or raise your hand or put some comments in the chat. Alternatively, we can get started with my definition. So this is what I like to use. Um, Global health is an area of study, research, and practice that puts a priority on improving health and achieving equity. Um, it emphasizes the transnational health issues and involves an interdisciplinary approach across many different sectors beyond just the health sciences. So it is big, broad, goes across borders, and has a particular emphasis on ensuring global health equity.
There's quite a few chat responses coming in now.
Oh, here
Just
we
to
go.
see.
Great.
Yep.
Thank you. Yep. Equity for all. Absolutely. Multi-approach study, well-being all around the world, health for all global citizens. Yeah. Health for all. So this is that idea that we should be prioritizing health beyond borders, that the health in one country, um, if there's disparities between the health of countries, that's something that we should be working to address. So when we talk about improving health, when within global health, it's about that equity regardless of borders. And it's beyond just the state of physical well-being, but also mental and social well-being. So it's a very holistic approach to health um, that reaches beyond the borders. And in order to achieve this, it really does require working across different disciplines, whether that be political, social, environmental, working on infrastructure. All these different disciplines must come together to be able to address the global health equity. And to do that really requires building partnerships. So one of the models that I like to use when framing global health is, I'm sure you've come across this before, is the social determinants of health rainbow, where we've got people in the center, and then everything that influences the health of individuals branching out or radiating out from that center of the wheel, where you've got lifestyle, community, local economy, activities, built environment, natural environment. But within all of these layers, we all sit within the global environment. And within that global environment contains things such as the climate, the political systems in which we live in, the commercial and economic systems which govern the world, including international trade agreements, um, the new technologies that get invented and then disperse around the world, biodiversity. So all these other elements sit within the global environment in which we all live. And the way that global environment is shaped determines the health of individuals within different countries. So some of these global determinants of health that I'll touch on today, that I think are some of the most important and have the biggest impact on health and well-being of individuals within different countries, are political determinants, the commercial determinants, and environmental global determinants of health. And if we were to define some of these, the political determinants really are how different power dynamics, institutions, processes, interests, and ideological positions affect health within different political systems and at different levels of governance. All countries are interrelated, and there is influence, political influence between countries and across borders that shapes the way that countries then build their own political systems, which then have a flow-on effect for health and well-being of individuals within the country. The commercial determinants of health really are about the strategies and approaches used by the private sector to promote products and choices that are potentially detrimental or beneficial to health. And then the environmental determinants of health include all the physical, biological factors external to the person that goes into shaping health and disease. So if we look at some of these in a bit more detail, I really like this diagram because it shows a bit of a spectrum. This is only one way to contextualize the political determinants of health across different countries, but this is quite helpful to understand where certain countries sit within this political spectrum. And where a country sits within the political spectrum really shapes the way that um, the determinants of health, those different layers that we looked at in the model before, how those then shape individual health and well-being. So for some examples, we've got neoliberalism, which some of you may have heard about, but this is a political approach that favors free market capitalism and deregulation. It's all about a reduction in government spending, and avoiding sort of social redistribution. It's generally associated with economic liberalism, privatization, free trade, and it's all about shrinking the influence of the government and expanding the private sector. And as you can imagine, this ideology and political approach has flow-on effects for health and well-being within a country. For example, reduced spending on public health services may mean less public health service availability, particularly for low-income families. New Zealand is an example of a neoliberal country, even though, we're sort of sitting in between social democracy and liberal democracy on the spectrum. We do have a public health system, but with changes in government, it's always potentially at threat from neoliberal ideologies. Whereas institutions or countries that have social democracy, these are predominantly capitalist economies, but with some varying level of state regulation in the form of welfare, economic interventions to support low-income families and communities, and aim to have a bit more of a more equitable distribution of income. So some countries, for example, that reflect this social democracy are often the Scandinavian countries, such as Finland, where they've got greater governmental investment in things like poverty reduction and increased state intervention into the economy. And then as we move further towards the Keynesian consensus, where the economy is controlled by government decisions, we're looking at economies such as, political ideologies such as socialism, which comes in opposition to capitalism and is based on the means of production being owned by the government. So there's increased government planning and controlling of the means of production. So at the global level, there's this spread of ideologies which can flow through from one country to another. And so in a lot of Western countries, for example, New Zealand, the US, Australia, we've seen a spread of the neoliberal ideology with a strong focus on deregulation and trade liberalization since around the mid-80s. And so this sort of spread of ideologies does have a flow-on effect on how we deliver healthcare within a country, and how we regulate a lot of the health-defining determinants, such as education, housing, infrastructure, for example. So, with that in mind, let's just take some time and put your hand up or speak out, or put some comments in the chat of have a think about what are some of the dominant political ideologies in your country. Are these political dominant ideologies influenced by the global politics? And then how do they have an impact on health? So just have a bit of a think, and maybe feel free to shout out or put some thoughts in the comments. We can have a bit of discussion on this before moving on to the next point. So in terms of the political ideologies and the impact on health, some of the things to think about are how does your country think about free markets versus regulation? Um, is there a prioritization of economic drivers over health? Does your country prioritize focusing on um, international trade agreements, free trade? Is there regulation around protecting the environment? How are health services funded? Are they primarily private funded with out-of-pocket payments by individuals, or is there some sort of insurance socialized funding scheme? Is there a fully funded public health system? So here are some comments. Myanmar currently political ideology is military coup, and all power seizes from the military personnel, especially they get power on all. Yes, exactly. So, that is something that would have a massive impact on the health and well-being of individuals within the country. So have a think of how that actually shapes the landscape of health and well-being. Some other comments look good. Good to see a lot coming through. Brunei has universal health coverage. So we can see there's a wide variety in the way that a country is structured, which has an impact on how it delivers its health services. Um, Global politics impact Indonesia through economic, diplomatic, and security channels. The adoption of the democratic reforms and decentralization after the New Order regime was strongly influenced by international discourses on democracy and human rights. Current global events such as great power competition, e.g. China and the USA, regional conflicts and proxy wars can also threaten Indonesia's economic stability and domestic politics. International cooperation and pressure have helped shape Indonesia's health and education policies, trade relations, and governance. Great. So these are fantastic comments. Really good to see people thinking about the international geopolitics and how that shapes the political ideologies of individual countries and therefore the health systems and the determinants of health within each country. Great. All right. So just conscious of time, we'll move on to the next point. And this is, so now spend a bit of focus on the commercial determinants of health. It's a bit of a complex diagram here, but basically these three interrelated factors of rising demand, increasing market coverage, and the continued internationalization of trade and capital investment have changed global business and consumption landscapes. So this is where private companies are gaining increased power with access to new markets and spread throughout the world. So in the last several decades, we've seen, and this goes alongside the spread of neoliberalism and these free trade agreements, but we've seen the spread of the impact of multinational corporations throughout the world. And this means this can have a potential harmful effect on the health and well-being of communities through these channels and so that they've spread through these channels of marketing, which enhances their desirability and acceptability of potentially unhealthy commodities, the supply chain, lobbying, and corporate citizenship, which can deflect attention and help with potentially tarnished reputations of these international corporations. And this means that they have the potential to increase the supply and demand of unhealthy commodities, such as unhealthy foods, alcohol, tobacco, and these then become more acceptable, more available, and often cheaper within the countries in which they're spreading to, increasing the rates of things like obesity, diabetes, cardiovascular disease. So a lot of non-communicable diseases associated with unhealthy commodities. In response to this, the WHO has put out some policy solutions which can help to reduce the impact of unhealthy commodities and the impact of these commercial determinants of health spreading to these countries. And these are things such as taxes, marketing restrictions, limits on nutrition limits, and minimum age requirements for some of these unhealthy commodities. So now have a think about what impact the global commercial determinants of health have in your country. Have you seen any changes in the last decade or so about the prevalence of unhealthy commodities in your country? Has your government put in any regulations to prevent the uptake of some of these unhealthy commodities? Let me know in the comments, and just have a little think about it. And thanks for posting that, Chris. Yes, there's a long history of the tobacco industry interference in through lobbying in governments. And then, and so tobacco is probably one of the commercial determinants of health that public health has made the most progress on. Alcohol, unhealthy foods, also fossil fuels, there's still a lot of work to do in getting to the same place that we've been able to get to with tobacco. Yeah, so those are some good comments. Ban on selling cigarettes, regulating junk food advertisement in Brunei. Exactly. So see, these are some of the things to limit the power of these international, transnational corporations, and the spread of these unhealthy commodities into countries. But every country has their own set of regulations that they put in place. And some are more restrictive than others. And often this is shaped by the political ideologies of those countries. Yeah, and we've been seeing rising non-communicable disease rates globally, and a lot of that is driven by the spread and increased power of transnational corporations and increasing influence in markets that they didn't used to have access to, often through international free trade agreements. Yeah. And so that's a good point. Even though we can ban a lot of these unhealthy commodities, there often does create a black market. So, regulations are great, but it's all about how well we can enforce them and how well we can monitor their effectiveness. So just read this one. Indonesia still has one of the world's highest smoking rates, especially among adult men and youth. The tobacco industry remains influential, and weak excise tax policies, as well as complex multi-tiered tax structures, make tobacco products widely affordable, undermining public health objectives. The health system bears significant costs from tobacco-related diseases, impacting the national health insurance system, and increasing rates of heart disease, stroke, cancer, and chronic respiratory illness. Yeah. So this is a great example of how these transnational tobacco corporations influence health and well-being within countries. So thank you for these comments. Yeah, these are fantastic. Really good to see. You're thinking critically about how the commercial determinants of health impact health within your country. So if we move on then to the last determinant of health that I'll talk about before moving on to, if we've got time, the work that I'm doing in climate change and health. So if we focus in on the environmental determinants of health, this is a model that I really like because it highlights, basically, if we look at it, it highlights the ecological ceiling that the world, that we live within our environment, that the capacity that our environment has, while also highlighting the social foundation. And so that means this is a economic model in terms of production. We need to aim to stay within above the social foundation to ensure that we meet the necessary requirements for health and well-being and thriving communities, while ensuring that our activities on the planet stay within the ecological ceiling. So we don't want to to overproduce, pollute, use up natural resources at a rate greater than the ecological ceiling, greater than our environment can handle. But at the same time, we do still need to use some of the natural resources to ensure that our communities can meet their basic needs in terms of things like education, food, water, energy, without resulting in things like climate change, biodiversity loss, air pollution, ocean acidification. And so this is from 2017, and you can see we are currently undershooting on every one of those, the social foundation, but at the same time overshooting in terms of the ecological ceiling. And this is because of the inequitable distribution of the benefits from our activities within the environment, and the unequal distribution of the negatives of our actions on the environment. So there's a lot of work to do to ensure that we meet the social foundation while staying within the ecological ceiling. So have a think about the global determinants, environmental determinants, and how these impact your country. Some of the things to think about are air quality, water quality, food supply. Obviously, climate change is one of the biggest global determinants of health. So how are these impacting health within your country? So a lot of these environmental determinants are often outside the control of an individual country. For example, climate change is caused by greenhouse gas emissions, which is primarily produced from high-income countries. Yet the burden of the health impacts from climate change falls on those often low and middle income countries, which haven't been the largest drivers of climate change. Air quality equally can blow across borders. Water quality can impact a country where upstream on a river, if it flows through another country, then the quality of the water flowing downstream may be affected. Equally, a lot of these are also in the control of specific countries through environmental regulation, which again is influenced by the political ideology of the country as to the extent of the environmental regulation in place. Good to see some comments coming through. In Indonesia, climate change and transboundary pollution, haze, rising temperatures, floods, droughts, increased respiratory disease, vector-borne infections like dengue, and disaster-related injuries. These impacts hit coastal, rural, and low-income communities the hardest because their housing, because their housing and healthcare access are more vulnerable. Exactly. Rising temperatures change disease patterns. Yeah. In Cambodia, such as climate change, air pollution, extreme heat, floods, droughts, and rising levels. These changes increase vector-borne diseases, reduce clean water availability, damage crops, and raise from risk from heat stress and respiratory illnesses. Exactly. So, yeah, you've all got it. We are facing a significant threat from changes within our environment, and these do have significant impacts for the health and well-being of communities. So for the last 10 minutes, I'll quickly take you through a case study of climate change and extreme heat, and touch on the research that I'm conducting currently through the Reflect trial. So I might just skip over some of these a bit briefly. Basically, we've had decades of climate change reports. We've known about climate change for a very long time. This was from 2023, where global surface temperatures are already 1.1 degrees higher than pre-industrial levels. More recently, it looks like we are going to overshoot the 1.5 degree limit set by the 2015 Paris Agreement. So climate change is happening. It is here. It is with us. This is showing the amount of greenhouse gases emitted so far through the black line, and then the future projected emissions and what is needed to really limit warming to either 1.5 degrees or 2 degrees. The red is our current trajectory. So significant progress is needed to avoid some very high level degrees of warming. And so what does this mean? If we do get significant global warming, we'll be looking at, we're currently on trajectory to hit about 3 degrees of warming by the end of the century. And so that's going to result in a shift in the annual hottest day temperature, which isn't evenly distributed around the world. Some places are going to be more impacted than others in terms of the temperature change. And this will have significant impacts on health and well-being. So some of the things that climate change is likely to result in terms of health are social factors, risking displacement of communities, forced migration, and the downstream mental health impacts this has of loss of home and loss of identity. Increased vector distribution with spread of mosquitoes carrying malaria, Zika, dengue. It's going to result in dietary changes with potential for food insecurity leading to undernutrition in many areas, but also potentially overnutrition and increased reliance on ultra-processed foods. So potentially increasing the double burden of obesity as well as malnutrition. It's going to risk access to clean water, which may increase the risk of waterborne illnesses, as well as water scarcity, and will have impacts on air quality. And finally, heat stress and extreme weather events. And so the area of research that I'm particularly working in is on the impacts of heat stress and trying to find ways to adapt to heat. So I think we covered this. Really, we talked about this when we covered the environmental determinants of health. So I'll just skip over this and start focusing on the impacts of heat. So again, this diagram is from the 2023 report. And if we are aiming, I think this is quite interesting because if we are aiming for, we're on track for a 3% degree increase in warming by the end of the century, what does this mean for the health from the combined impact of heat and humidity in different regions of the world? And you can see this shows the number of days throughout the year where the combined heat and humidity will be a health risk to humans. And at this, about 3 degrees of warming, we're seeing significant portions of the year, particularly in the Southeast Asia part of the world, where the combined impact of heat and humidity is likely to have significant impacts on health. So we urgently need to find ways to adapt. I'm going to skip through these slides. Basically, heat can have a detrimental impact on health, causing an increased risk of things like cardiovascular disease, heat stress, diabetes, stroke, and it's impacted by the environment in which we live in. So the way the city is built, if there's green spaces, blue spaces, areas for ventilation, the way the buildings that we live in are built, and the way in which we interact with our environment impacts our exposures to heat. Heat can also have a lot of downstream impacts on health services, power supply, schooling, air pollution, productivity, and so impacts all those other determinants of health that we talked about earlier. And so I'll just skip to, so what we are trying to do about this is we're working on the REFLECT trial, which is a cluster randomized trial looking to see whether a reflective roof coating can reduce indoor temperatures and protect people from the impacts of heat. So we are working in these 4 sites in Burkina Faso, India, Mexico, and Niue. To see if these cool roofs are effective across different locations. So we chose to look at cool roofs because they have the potential to be something that is affordable, safe and simple to install, and scalable. So we're wanting something that can be given out quickly to whole communities. We all know how effective air conditioning is, but it is expensive, requires electricity, and is not really a suitable public health intervention that can be provided for whole communities very quickly. And so this research is setting out to see whether these cool roofs can improve health and comfort for the residents in the homes, potentially lower household energy use through reduced fan use or reduced air conditioning, improve productivity, as we all know that trying to work when the temperatures are really hot is very difficult. And then if these cool roofs are able to reduce the negative impact from heat on individuals, then does that have a potential positive impact on healthcare costs in the community? And if electricity is generated through fossil fuel use, then if we lower energy household use, what impact does that have on greenhouse gas emissions? So cool roofs, they are sort of a reflective roof coating that can be applied to existing structures and is just painted onto existing roofs. Lots of commercial products available, and we're using locally developed products at each of our research sites. This is a pragmatic real-world study where we are recruiting 400 participants at 400 households with 2 participants per household at each site. and measuring a wide range of health and well-being indicators because the impacts of heat are so impact so many parts of the different body systems, as well as those downstream effects on productivity and potentially hospitalizations. So this research is still ongoing. We'll be finishing up in our first research site in Niue by the end of the year. Hopefully we'll have some results. And then the idea is that if we show that these cool roofs do have a health impact, we'll be able to measure how much of an impact they have to a cost effectiveness analysis, and then we can go to governments, NGOs, international funding bodies to say, hey, look, this is something that we can do now. It's practical. We can go out and paint whole communities for relatively cheap as a urgent climate change adaptation intervention. So hopefully we get some positive results, but we're still in the process of conducting this trial across the 4 sites. So I think with that, I open it up for any questions about anything that I've covered so far. Could be about the global determinants of health or about the research itself. I know I've just gone through really quickly about the research, but given time, I thought I'll just touch on it. Happy to answer some questions.
Thanks, Noah. So yeah, pop your questions into the chat and we can, or unmute and we can maybe interact through the audio. I think it's really interesting work that Noah's doing, and he's got some great insights from qualitative work built into the randomized controlled trial. So it's a mixed methods model that we've talked about during this course that provides those deep insights into people's lived experience as well, and their perceptions and concerns, as well as you know, the quantitative material. So if anybody else got any other experiences of anything similar or would like to know more, I'm sure you can reach out to Noah and he'd be happy to contact you. But any questions for him about anything he's mentioned? Here we go. Do you have cultural resistance or technical resistance during the implementation of cool roofs? Haha.
That is a
Touche.
great question. Well,
Yeah.
yes, this has been it's a very ambitious project, and implementation has been a huge challenge. I have been particularly involved with the Niue site, so I can primarily speak to that. But Niue is a small Pacific island, about a 3-hour flight from New Zealand, north of New Zealand. It has a population of 1,600 people. So you know, that's really, it's a very tiny population to be running such a big trial. So there are flights there once a week and shipping once a month. So in terms of logistics, getting all the materials there, building a team that can actually carry out the research has been a massive challenge. Recruiting participants to take part in this research when we aim to get 800 participants out of a total population of 1,600. Again, very challenging. Some of the things that we did that were really successful, I think, was having a huge focus up right at the start of the study in building those relationships and connections with people on the ground. So we spent months of back and forth with the Niue government, the health department, utilities department, community leaders, so the village council, and then community meetings. And we also went around to every village around Niue to provide them an opportunity to hear from us, as well as to discuss the project through an open dialogue. And at the same time, conducting these focus groups to understand the acceptability of cool roofs, as well as the trial methodology, and then sort of shaping the study to make it as acceptable as possible, while maintaining consistent methods across the 4 research sites. So maintaining global consistency while fitting it into a local context. And that's also something that's very challenging. But yeah, I think we're getting there. We're making
Yes,
progress.
questions. It's great. Questions about the reasons for choosing the sites and what made choose the topic and locations again.
Yeah, great questions. So, in terms of choosing the sites, part of it is about relationships already established in these areas. So just practical reasons. We've had relationships with so all of the sites have a university that's working in the site and at the location. So some of the research team had relationships with those universities, but equally, these sites are places that are already impacted by extreme heat, um, are likely to suffer from increased temperatures and increased heat due to climate change. Where there are low-income communities that potentially lack the ability or the capacity to implement adaptation measures. And so we're really trying to find and why did we choose cool roofs? Because they present an opportunity for something that can be scaled through some of these low-income communities as a way to quickly help. It's not going to be a silver bullet. Ideally, we rebuild homes that are suited for the heat, but it is an intermediate measure, and something that can be incorporated within greater other housing adaptations.
You might want to
So
mention about monitoring indoor temperature and relative humidity
yeah,
and heat stress briefly, how you've used the integration of data from different
yes.
devices to inform the outcome.
So the way that we're measuring all the data, we've got a range of different measurements. Our primary outcomes are measured via household questionnaires. So we go around to the households 7 times throughout a 12-month period to see if there's, and that's also to see if there's any fluctuations across a whole year, so across different seasons. And within those questionnaires, we're asking questions about comfort, any symptoms, any new diagnosis, etc., as well as taking physical examinations. So we're measuring heart rate, blood pressure, temperature. Every house also gets a temperature and humidity sensor that we place on the wall within their main living space. And that's to then correlate the health outcomes with the temperature and humidity within the homes. We're also running one blood test, which is the HbA1c to measure blood sugar as a marker for diabetes. And a proportion of the households and participants get a smartwatch, and that will measure physical activity, sleep, and heart rate. So using a range of different mechanisms to try to measure the impacts of heat and then the impacts of cool roofs by potentially reducing indoor temperatures.
Yeah, and Noah, I think we're out of time, but you can find out more about this particular study. I think we've popped up a link on the Canvas site, and you can go into the study website on the
Here's
chat
the
if you
study
like. Yeah,
website. Yep.
that's great.
There you go.
Reflect.org.nz. And it's being led out of New Zealand, but the partner countries are also co-investigators, and it's funded through the Wellcome Trust UK. So Noah, thank you so much for a masterly coverage of a huge topic, and just show our appreciation to Noah for his presentation. And then we're going to just have a couple of seconds break, and we'll move over to Foot. And Foot, you've got, I think, until 3:45.
Yes. Yes.
Yep.
Wow.
So just maybe we can just have a little bit of a few minutes break if anybody needs to stand up, move around, have a glass of water, and then we'll pop back. It'll give you just a couple of minutes. My grandchildren have just turned up in the house as well. So if you hear any extraneous noise or sights in the background, they've just come home from school. Okay. So thank you again, Noah. Show our appreciation with our usual reactions, and we will give Pete a few minutes. So thanks
Thank
very
you.
much, everybody. And
Thank
great engagement, by the way, everybody. Thank you
Yeah.
so much.
Thank you
No,
for
I
all
will
the
be with us
comments and
until 4,
questions.
right?
Yep.
No, you will be with us until 4.
Oh, yep. I'll
Oh,
be
you're
online
standing by.
and be here. Yeah.
Brilliant.
Yeah.
Thank you, Noah. Fruit, I think we can hand over to
Juanita,
you.
could you make put co-host?
I'm here. Okay.
So big welcome again back to Dr. Poot, who's did a great talk yesterday, I believe, and I'll have to catch up with the recording. And I haven't had a moment to spare since yesterday, but I had some very positive feedback. So great to have you back, following on from Noah's talk, and we really look forward to what you got to share. And you have the distinction, Poot, of being the final speaker in this course prior to their graduation. So no pressure.
Yeah, such an honor.
Finale act is put.
Yeah. But my session is quite not so many here. It's just a brief, and yeah, and before I jump to the group discussions, which I and Noah will like moderate a small group discussion before finish.
Perfect. So you can start whenever you're ready. Yep, perfect. Thanks, Poot.
And we can see your screen, put.
You can see it, right?
Yes, it's okay.
Okay.
Yep.
All good, Poot? Poot, are you ready to go?
Yes.
Okay.
Yeah. How about the participants? They all here?
I think we're all back.
Yep. Everybody's here.
Okay.
Waiting for
Okay.
you.
Yeah. I can start. Yeah. Just waiting for the reminder. Okay. Thank you, Chris, and thank you, Noah, as well for the introductions to the global health. Yeah. Actually, this year, Noah, PP, and I are sitting very near each other. Yeah, in our office building, but Noah and PP are very busy persons and a lot of project to do. Yeah, and also Noah is recognized as a very great speaker. So he's a winner of our university competitions at 3 minute thesis, and then his this is very interesting. Yeah, okay. Anyway, yeah, back to our part two, global health in crisis and challenge and solutions, and then we'll look at some example in ASEAN country. Yes, as we know nowadays, that our health system like experience what they call overlapping shocks. So it's like simultaneously experience NCD, pandemic, infectious diseases, and conflict disasters all together. And so that's why today we'll introduce the term of premier crisis, and also seeing some example uh, of the health problems that impact the situations and the health system, and looking at the double burden of disease and the key challenge for the ASEAN health system, the regional gaps in preparedness and transnational uh, problems, and also some potential solution. Yeah, if our participants have some questions that you can uh, feel free to chat or unmute anytime. First, we will I will talk about the key concept, the term of permacrisis, which is confirm the combinations of the permanence and crisis together. So the meaning is from calling English dictionaries is an extended period of the instability and insecurity. Example, when the problems happen and it still continues impacts many sectors in our social and communities like social, economic, environment, and political in nature. And the problem still not finished, and then the new problems appear before the old problems are solved. And this makes the country feel like they are always in the emergency mode all the time and it's not finished. This is some of the key features of the term of the global health and permanent crisis. Here, the first example is a multiple simultaneous emergency. As I said, I mentioned before, like the COVID-19 combined with some war conflicts or climate change disaster, and then the funding cuts or like donor problems. And others is the health, the weakening of the health systems, the long-term impact on infrastructures and human resource or healthcare providers, disrupt the supply chains and medical resource and equipment. Example, the essential medicines and the vaccination. The donor fatigue and the funding gap. Example, like this year, I think a lot of people experience, or especially in the low-income country, that the funding cuts from USAID and the budget reduced. And some of the cross-border impacts like disease outbreaks and migrations and the misinformation. This is the real examples, some of the example of the global health crisis. The first one is after COVID-19, so it's not just it's not finished there, but there's some impact on the what they call a post-COVID system strain. So many health workers still exhausted or the routine health service still impact has been delays and for many years and up until now, and the disruptions affects the NCD management and also some of those chronic problems, the immunizations coverage and also maternal and child health services. And this still already a problems in some country, in ASEAN as well, in some countries, because ASEAN community, we are not in the same level. It's different in terms of like social economic backgrounds and status. And the pandemics left long-term pressures on the health system and reduced access to essential care. Yeah, as we all allow as well that the US is cut and then a loss of like workers and loss of health projects finished and still find way to continue. So many low and middle income countries rely on international funding for HIV treatments, tuberculosis, and the maternal health programs in Laos, Myanmar, or Cambodia. Funding has mean fewer medicines, fewer services, and weaker health system, and also also threaten the major global initiative like some emergency plan and also those family planning programs that some of the program that we do to help improve the emergency preparedness in the regions. And also the cutting of the funding also means that the health risk will become more bigger. And the next one is, of course, war and conflict. So it's not just only effect or impact on certain sectors, but also health sector as well. Examples is the very prominent war. In recent years, the Russia and Ukraine war has driven global socio-economic and exports or the supply chains that lead to the food insecurity and increases malnutrition in many countries. They also cause a lot of refugees and movement and pressures on health system in neighboring country, and with some of the area just already have some underlying health problems. Some regional wars that create the global health problems, increase food insecurities, malnutrition, and health service problems. And some example of the current war that affecting global health system. I think recently is the Gaza Israel Hamas conflict, which WHO reports that it has devastated Gaza health infrastructure, and some hospital and clinics have been heavily damaged and destroyed. And in our ASEAN country, the Myanmar, I think some of our participants also mentions about the civil war, and also like I have discussed with PP as well about this situation is still like long lasting and up until now, and the Sudanese civil war in Africa, and also the current this year I think Thailand and Cambodia border conflict, this escalations in this year. And yeah, of course, the vast cost of collapse in many health facilities, a significant proportions of the hospital in conflict area, and make it cannot operate because are non-functional. Yeah, actually, yesterday we also talked about some disasters and health emergency that relate to climate change. And today, I think Noah also mentions about global health that relate to the climate change that can induce the global health disease and then the disease outbreak as well. The research of malaria and dengue, yeah, this is really related to climate change. The heat waves, the floods that creates more mosquito bleeding sites, and increased example for the dengue case in Southeast Asia every year during the monsoon rain season. Summers, we are not really have summers though. We have just dry and rain season. Yeah, just season, no force, not really like four seasons in other area or regions. The climate also increased the problems about the refugees as well. So people forced to leave home from the storm of floods and then increase the burdens of the health system. Example, in the pictures, there's the flood in Bangladesh in like a couple years ago. The first thousand of people to move, relocate to other places, and then a lot of disease that relate to floodings and also climate change also happen time to time. That's why it becomes a double burden of disease. And then the case in ASEAN, which we have a persistent communicable disease, like tuberculosis is very high in our regions. And then the others, as I mentioned, dengue and malaria and HIV and it still continue affect many people. Especially for TB's outbreaks in density population and also some problem of the ongoing of continued new treatment. So that's very difficult in some specific area that hardly to reach and then to continue the treatment because as we know like TB treatment need very carefully like treatment time to time. So not just only one and then finish. And other factors is also the risings of the rise of the NCD, yeah, non-communicable diseases like cardiovascular diseases, diabetes, and cancer, and especially it's very nowadays more common in diabetes type 2 in the urban populations. A lot of uh, country that have like the improve of the economics become more have this problem a lot, yeah, in many country in Southeast Asia as well. The health system typically not really prepared or not struck for both disease together. So some many countries struggling to manage infectious disease both with the NCD at the same time, and then some clinics focus on malaria may lack of resource for chronic disease care. And the urbanizations and also aging populations accelerate the NCD as well, the global city and older population lead to more lifestyle-related disease. The heart disease become more common, and in those are like I'll say many city that in ASEAN now become more highly developed than before. Yeah, and this is also some key features of the climate induced migrations and health gaps in ASEAN regions. So climate change, that we know, like the rising of the sea levels and force people to move from rural to uh, urban area. The health system in the area receiving these migrants are often unprepared. Sometimes local clinics overwhelmed with the new patients in urban centers, and also some public health impact from the transnational border disease or global health, like malaria, TB, or even the previous COVID-19, and the stress problems in sanitations, mental health, maternal care, as well. Some of the limit regional coordination, even though we already have some the frameworks of the ASEAN in terms of the collaborations and coordination. Yes. The next one, this is the current big problems in our regions. I would say the impact of the scam on the ASEAN health system. So it's probably not really direct problems, but this is a very big issue that impacts in multiple sectors. So not just only health, security, socio-economic uh, sectors, but also the health uh, system as well. Examples like the mental health crisis, rising from anxiety, stress, and depressions among those victims, increased suicide, and high risk of the some of the victims in some of the country within the regions, and the trauma among those traffic victims, physical abuse, malnutrition, and infectious disease rich in those, not just only area, but they call scam centers. So in Laos as well, we have the centers, and the limits access to the healthcare and the rescue of the victims. The threats for digital health, yeah, of course, the scams, many type of scams, and it's really social media, digital health, telemedicine also some impact. Socio-economic determinant of health, the financial loss was the ability of them to access to the healthcare, and also those healthcare providers, if they like become the victims, and a lot of problem also impact on the service as well, the health service system, those emergency or the burdens of those trauma or disease in term of, as well as the recovery. This is a real example, I would say, for many countries in Southeast Asia. Yeah. Example like in Cambodia, it's Sihanouk scam compounds. It's a loss of hundreds of victims. We can read and see from the news. In Myanmar, the civil regions holding scam operations. In Laos, the Golden Triangle areas and unregulated zone, and also like have a lot of like human trafficking and victims due to the scam. In Philippines, scam centers recovery in Manila and Clark. And Thailand is also recognized as a major hub for the scam labor trafficking rescue operations ongoing in Vietnam, Malaysia, and Singapore. The a lot of victims that affect from the scams and rising of the investments of the scammers. So as we see, there's a lot of these countries are interconnected. So this is not just one country, but we all affect all together as a region. Yeah, this is becomes one of the key example of the how importance of the global health that nowadays. Next, I will introduce you about the some like potential solutions. So it's not really a gold standard solutions probably be, but these can be a guide or yeah lead to some that we thinking or consider in terms of to make some plan for the solutions, as we are all of us as health uh, health research healthcare policy makers or even healthcare providers. First, strengthen the integration of the health system, like expands primary care that can handle in both NCDs and infectious disease, improve digital health, universal health coverage, the inclusivity, includes those ethnic minority, refugees, migrants, to be able to access to the health services, and train our local healthcare providers to be able to effectively manage crisis, have a leadership program in terms of managing pandemics and natural disaster. And next, boost regional cooperation. Yeah, as I said, like a lot of transnational health problems or global health or even issues. It's not just only one country that can solve, so we need to work together and collaborate, strengthen in the regions like ASEAN's health clusters and emergency workforce sharing. So doctors, examples, if doctor from one country can help the other country, especially during emergency or disease outbreak. Uh, Boost data sharing, coordination, the cross-border health response is very important in terms of to track or even monitors and disease and the outbreak. Build on mechanism like the previous or current like ASEAN COVID-19 funds and ASEAN Bio Diaspora Virtual Centers. This is the program that create from the ASEAN Association, yeah, to improve the emergency preparedness and response in the region, like joint fundings on research to response in the regional health threats. Yes, funding is very important. The next potential solutions, yeah, I think for the climate resilience and health planning, I think Noah also talked about some solutions and how to cope or even to solve some nowadays problems. Yes, and climate-proof facility, supply chains, ensure hospital, clinic, and medicine every is an extreme weathers and disaster, integrates the surveillance and early warning system, localized health action plans, for example, in Thailand, develop community-specific strategy to address heat wave and climate change-related health risks. So the heat waves, and I think some of our participants have mentioned that it's happened during our hot, I would say, hot season in Southeast Asia, in all the country experience very, very hot weather. Yes, and a lot of those older peoples die a lot, many during that time. And also improved equities and data-driven policy, collects a multiple type of the health data, gather informations like example, age, gender, location, income to identify who considered to be those vulnerable group of people. Applies, yeah, I think some opposition also mentions about One Health and planetary health frameworks to recognize the link between human, animals, and environment health for create or enact a better health policy that includes all the social determinant of health, engage community to participate in terms of the planning, includes local people to have some voice in terms of decision making to ensure the interventions are practical and acceptable. Another potential solutions, as we all know, that the health financing is very significant in order to maintain all public health programs or health services local. So in terms of the sustainability of the health financing, some of the example of the potential solutions that you use of the cigarettes or cigarette products that the increased tax, those things to fund the universal health coverage, generate revenue for universal health coverage for tax harmful products. It's somehow in some countries it's very difficult in terms of to increase the tax, especially for the state enterprise that relate to some products in Laos as well. The tobacco company is straight enterprise, so sometimes this is very controversial to someone to decide. Yeah, there's some sales problems in some country. Support local community health workers with the formal pay ensure a consistent, motivated health workforce at local level. As we know, that health workforce is one of the main components in the health system building block. So we cannot just focus in other area and leave other area the health service and healthcare provider, especially in Southeast Asia. In some country, we have really low pay. Even you are really high qualified healthcare providers, the payment is very low. Yes, sometimes it's not really in terms of the motivations of the local workforce. Encourage public and private partnerships to increase the fundings, combine government and private resources for a better health service delivery. Yeah, I think quite that's all for my part and to cover some
Okay.
of just the main, yeah.
Wow. Huge scope of coverage there. Thank you so much for your presentation. Now, did you have some questions for us to work out in small groups? Yep. Okay. So I think this is an opportunity now to break out into our small groups, and we've got about 30 minutes, I think, before we have our break. So
Yeah.
what do you think? 15 minutes in group work and 15 minutes feedback?
Yeah, sure. Like I would say like 10 minutes discussions because
10 minutes
5
discussion.
minutes probably to 10-minute discussion, small group, and then
Okay.
some time for
And
the
then,
presentation.
yeah. Okay, that's great. Okay. So you've got that slide in front of you. What's the most urgent cross-border health issue in ASEAN today and the practical action? And then some prompts below. So what we can do is post those up on the chat, or we can actually send that screenshot, can't we, to the breakout groups. So Juanita and Gay, can we help
Yes.
doing that?
So I'm going
Thank
to
you.
open the breakout rooms now for 10 minutes, right?
Yeah, so
So we
10
have-
minutes in the groups, and then
Yes.
come back for 20 minutes of sharing. So a
Oh.
spokesperson from each group will bring the findings from each group back to the whole plenary.
Perfect. Let me open the rooms and I help you with this.
Thank you,
questions.
Juanita. Thank you,
Okay.
Bert. So facilitators who can go to the groups, that would be great. And we'll call you back in about 10 minutes.
So now I'm going to share the question
Yep, please, that
on
slide.
my
Thank you.
screen. And
Right. So we have 15 minutes. Let's give about 2 minutes per team to answer the prompt and potentially talk about some of the follow-up prompts. So let's go in reverse order just to mix things up. Can room 6, you've got 2 minutes to present on the topic.
Room 6 is Adi, Apinia, Rina, Sapal, Suthida, Yuli.
Did you nominate someone to present back to the group?
Okay, good morning, Professor.
Go ahead,
Sorry.
Rina.
Yeah, hello. Yes, welcome from Cambodia. Yeah, and we are discuss about the global health border, cross border. Here we are talking about the COVID-19 as well as the other flu as well. Yeah, and these are the corporate, and the other one is that the who is responsible firstly is about ASEAN health cluster, and the problem is that the barriers that we are discussing about here that related to the people awareness and social economic and donation as well. Yeah. Yes, that's all from our team that we are discussing about this one.
Okay.
Thank you.
Thank you. So what was the reason that you chose COVID-19?
because the infectious disease can be rapidly transmitted between countries. Yes, and there is some barrier, like Rina Kil mentioned before, lack of data and information sharing, and weak surveillance system, and also inadequate infrastructure and equipment.
All right, thank you. And is there anything being done to support the region in terms of preventing the spread of COVID?
Group 6, I think Noah asked a question about COVID. Anybody from your group?
We discussed about the COVID-19, monkeypox, TBC, and also infectious disease that can transmitted between countries. For the example.
Okay, thank you. All right, now room 5, what did you discuss about?
Hey, got 5, the more ASEAN cross border health trade for facing ASEAN to the Arabic spread from the rheumatic infection disease, zoonotic disease, zoonotic disease, bird food, and infection disease, global household, hormone and animal infection. Yes, the problem we getting from the climate change.
Yes, I mean that is a huge issue with the risk of zoonosis spread from animals to humans, particularly with climate change, where there is increased interaction between animals and humans, as well as humans encroaching on animal habitats. So that's a very important one. Did you have anything that you discussed? Any barriers or things that are being done to reduce the risk?
We can create your real-time digital survey from platform from the one here. This is the system would from inclusion to women and animal and environment data standard reporting across all countries together similar Europe Union. Yeah. Immediately call for the outbreak from the responding from the mechanism by across border. Yeah.
Yeah, so surveillance, to be aware of, as soon as anything's detected, to share the information across borders, and to have a shared surveillance system that is understood and interpreted across borders is really important to reduce the risk of new infectious diseases through zoonosis. So thank you, that's really good. Room 4.
Room 4, maybe Chan Yen can represent room 4.
Hello.
Go ahead, Chan Yen.
Yeah, I want to represent as a representative of the group 4. There will be a 3 country discussed about the communicable disease, especially on cross-border issue. For PNN, there will be an infectious disease was a cross-border issue, especially for a health threat in PNN. The polio was eradicated in 2000. However, there will be a now emerged now, and there will be an emergency crisis in this, especially on border issue. And in Myanmar, there will be a communicable disease, HIV/AIDS, then communicable disease, especially on TB and malaria, and facing people liver disease, especially on cross-border on Myanmar and Thailand, because due to a current political crisis and can control in the cross-border area, and the other country, Indonesia, also discuss on the cardiovascular disease issue on the cross-border, on the smoking, especially on tobacco users. So we also discuss especially on communicable disease and infectious disease, such as cross-border health threat currently now.
Yeah, fantastic. There's some good examples there. So why do you think there's an increased risk of polio across borders? Did you discuss the reasons as to why that might be the case?
Uh, Trent, Ian, can you explain on this?
Yes,
Yes.
yes. Thank you, Chen. Yes, in my group 4, we already the risk of the polio. Actually, is a Asian country. We already the certificate from WHO to eradicate the polio, and so until now the we have the inform from WHO to have the case from the vaccine in the Laos. So so we the country in the Vietnam and other country in the ASEAN, maybe we have a risk the spirit the polio case from Laos, as maybe we spread to our country. So
Yeah.
I think it's the Asian country will work together to strengthen the disease surveillance, especially we can sharing the data when we have about the case, a polio case, in the real time. And so maybe we have the plan in the country and maybe is the reason to prepare for the risk the health care spirit in the country.
Great, thank you. Yeah, one of the other things to consider with the cross-border risk is the spread of misinformation and anti-vaccine sentiment, so falling vaccination rates. With misinformation through social media is now spreading so much faster than it used to. So that's also affecting communicable disease risks internationally. So thank you. That was room 4, so room 3.
Yeah, I am Anida from Group 3. For us, the most urgent cross-border health threat in ASEAN is the spread of infectious disease, especially respiratory infectious disease, because they move easily across border in our region. And the practical action that we can strengthen is about same with other group surveillance system, so we can share the data and also can detect earlier about the outbreak. We choose this threat because it affects everyone and also require all sectors to work together, led by Ministry of Health, for example, and another sector. And the barrier for the barrier is about different interests and priorities about the from the sector or country. So maybe other member of Group 3 want to add something.
Hi. So we talked about the issues with infectious diseases. Some members mentioned like between Myanmar and Thailand, they had issues with even getting vaccination procurement issues across the border because of the military situation and in terms of uh, the barriers. So everyone has their own priorities. Each agency has their own priorities. Even the ministries, the country itself has its own priorities. So working together with different countries can be difficult. However, we have mechanisms in place, such as to the ASEAN health clusters, to other ASEAN mechanisms. Also, we can also get support from WHO and other international NGOs to actually facilitate even the discussions, or also support in terms of financing and technical support. Thank you.
Fantastic, thank you. I see there seems to be a common thread between the different groups is communicable diseases as top priority. Room 2.
Yeah, for group 2, we have discussed, but we got a different statement about the most urgent cross-border health threat in ASEAN. But maybe I would go first, and maybe Nino will add something to it. So I think most urgent cross-border health threat in ASEAN is dengue fever. Based on our data and cases in Southeast Asia, due to frequent outbreaks and also movement of the mosquitoes across the countries. And also Asian countries are experiencing a significant resurgence of dengue, making it a persistent and growing public health threat in Asian countries. One practical action Asian countries could take together is share outbreak data, research, and vaccine access, and run coordinated region-wide mosquito control campaigns. And who should act first? I think national ministries of health of each countries as the focal point, with support from the Asian Health Cluster, and should lead data sharing and coordination. And then also they also cooperate with local governments to implement mosquito and control efforts. Barrier that maybe we will face of the cooperation is different surveillance system, limited resources, and varying national priorities can slow joint actions. I think like that. Maybe Nino can add something from my group. Mr. Nino, Sir Nino.
Yeah, thank you, Ritz, no, and our team. Aside from those emerging problem in Asia, we do not forget also that Asia has the highest rates of hunger and malnutrition, and we think that we have the double burden of malnutrition, the undernutrition and overnutrition, and we have commitment at the United Nations, and we need to all help our communities in order to boost our health and nutrition landscape. And how to do that, we need to drive our forces in terms of food and diet, meaning we need to ensure food security that is enjoyed by our Asian countries. Secondly, along practices and behavior, which means that we need to adapt behaviors that are practical and essential. And third, we need to have coordinated and exclusive integrated quality nutrition and related services, including the child health nutrition. And last, and we need to have an enabling environment that supports improved nutrition outcomes. And that means that we need political will and policies that will implement all of this. And if we have this all, we need to call an action that we need to scale up nutrition in every nation. And doing this, we have boost or robust in terms of our economy and productivity. Thank you.
Fantastic, very in-depth response there. So that was really, really great. And adding in the NCDs as well as non-communicable disease, sorry, as well as the communicable diseases is good to remember. Room 1, final word.
Hello, hi everyone. So I would like to discuss, this is based on our group discussion. So regarding the emerging cross-border health, that focusing on health, basically, if we talk about ASEAN, it's always about, we have the highest risk of epidemiological issue, especially on the communicable disease. So whereby we know that most of us, I mean, the country we have a displacement, for example, in Myanmar, maybe in terms of massive labor migration, especially into Thailand and also in Malaysia. And we have a climate-driven disease shift, and also the weak cross-border surveillance. And this is, I mean, an opportunity for all the migrants or maybe the immigrants to come to this country. And what is the most critical threat to the cross-border is basically we can say the TB, okay, tuberculosis, and maybe the drug-resistant tuberculosis. So most of the, as far we know that Thailand, for example, one of the major transit destination for the Myanmar migrants, okay, and Malaysia, okay, receive, I mean, one of the highest migration from country, especially from the ASEAN and also the South Asia. Basically, they are more focusing on the plantation construction. Okay, so we know that basically when we talk about migrant, they are interrupted sometimes with their treatment, and there's no any medical record, or maybe they are feared for deportation. And also we know that most probably because of the limited screening and also the follow-up. And and also we can focus on the dengue itself. This is way more forward in terms of climate-driven vector-borne disease. We can see because of the dense settlement and maybe poor waste management and also the migrant work camps. Okay, and for the action that been taken, basically what we can see that is always for the national interest perspective. I don't see that we have a joint joint practice in terms of how we want to combat this kind of problem. This cross-border threat is always is become a national interest. But the thing is, we know that everything that whatever we want to do for the implementation part is always about who are going to fund. How was the impact? Are these realistic, or maybe we can see, in other words, are this initiative is a low cost that can bring benefit to the both country as well. So for me, I think it's always we need a one practical ASEAN action. So that is a starting point, and there's many more things that we need to see in terms of this cross-border threat. It's not only infectious disease. Thank you.
Thank you. Fantastic. Thank you all for the great discussion. I think that is going to close our session. So I'll hand back to Chris.
Yeah, thank you so much, Noah, and thank you everybody, spokespeople from each of the groups, but also all of you for the fabulous group work. There's so much expertise within this group. It's been a pity we haven't had more opportunity through the course to engage with you, but so I feel like we've just touched the tip of the iceberg, but some great examples, different perspectives from your own situations. And, we could go on, but we can't. We need to have a break. So I'm going to call this part of the session to a close, and we will have a pause for 30 minutes and be back in 30 minutes time for the completion ceremony. So if you need to go and get a stretch, bathroom break, or attend to any urgent matters in your workplace, now's the time to do it, but make sure you're back in in just under 30 minutes.
Yeah, please ensure that you're back
early
before
rather than late.
4:15,
Yeah.
because we have guests joining us at 4:15.
Yeah,
And
it's
Chris,
4:15
just
NZT, sorry. Yeah.
New Zealand time. Yep.
Yeah.
And just reminder, there are still a few of you who have not completed the core survey. It's very important. As I mentioned, the last time that we had this, Chris, you had 100%.
Yes, we did. Yeah.
So we don't want that to change. So please do complete the survey, if possible, during the break, if you could do that, or make sure that right after the completion ceremony, you do that if you need more time.
Yeah, and that's just gone up in the chat, the link to that. So there's plenty of opportunity to do that. I'd just like you to show your appreciation to Noah and Food for this closing session, and send them on their way. So thank you guys for your excellent presentations and sharing your knowledge and expertise.
Thank you as well.
Okay, so we'll see you all shortly.
Okay, it's 1:15, so let's get started. Tēnā koutou katoa, welcome to our completion ceremony for you, our MFAT Manaaki scholars in this public health management course. So we will, I know you probably did one at the beginning of your session today, but we have some guests joining us. So we will begin with a karakia to welcome our guests in. Tutawa mai ki runga, tutawa mai ki raro, tutawa mai ki roto, tutawa mai ki waho, kai tau ai te mauri tū, te mauri ora, ki te katoa, homie, huie, tai ki e. Tēnā koutou katoa anō, ngā mihi nui ki a koutou, no mai harimai ki te wharemaria tātari kaupapa, mauria mai o koutou nākou, o koutou hinengaro, o koutou wairua, nō reira, no mai harimai koutou. Ko Suzanne toko ingoa, tēnā koutou katoa. So welcome everyone to our scholars, to Ruby, our guest from MFAT, to the Wellington Uni Professional family, Sam and Emily, and of course to our wonderful public health management colleagues, Chris, Monica, Dilla, Pipi, Put, and Noah. Welcome to the Public Policy Institute. As I said, my name is Suzanne. And it gives me great pleasure to congratulate you all on your successful completion of this course on public health management. So we will begin our ceremony today with a welcome from Ruby, our MFAT representative. That will be followed by a waiata, by a song, and then the certificate presentation, the exciting bit. After that, we will give you, our scholars, the opportunity to say a few words before closing off that part and handing over to the staff from Wellington Uni Professional and here at Waipapa Toro, the University of Auckland, to say a few words. And then we will have another waiata. Then we will have a group photo, which I will post on Canvas. And then we will close with a karakia. So without further ado, Ruby, I would like to welcome you to say a few words.
Thank you. Can you hear me?
Yes.
Perfect. Warm greetings to our completing Manaaki scholars. I am delighted to be with you today to celebrate your achievements. The guiding whakatauaki for the Manaaki New Zealand Scholarship Program is He Pariro Toro Ao, which means stretch your wings out to the world. This Māori proverb was gifted to the program to represent and honour Manaaki scholars and the journey that they take. This ceremony marks an important milestone in each of your own journeys. In completing this degree, you've shown dedication, curiosity, and a commitment to yourself, your communities, and your countries. You may have overcome significant challenges to make it to this point. I acknowledge your tenacity and dedication and the care and support of your family and friends. On behalf of the Manaaki New Zealand Scholarship Program, the Ministry of Foreign Affairs and Trade, Manatū Aorere, and Education New Zealand, Manapō ki te ao, it is my great privilege to offer you my warmest congratulations. I also extend thanks to the team at PPI. In addition to a world-class education, your role in uplifting our scholars embodies the spirit of manaakitanga that is at the heart of our program. Thank you for your efforts. The New Zealand Ministry of Foreign Affairs and Trade acts in the world to build a safer, more prosperous, and more sustainable future for us all. Through diplomacy and trade and development partnerships, the Ministry works to promote peace and prosperity and support resilient, thriving communities at home and abroad. The Manaaki New Zealand Scholarship Program is a vital part of this mission. For 75 years, these scholarships have invested in the education and professional development of individuals from partner countries to build knowledge, skills, and connections. Now each of you are members of our global Manaaki alumni whānau. You join a legacy of thousands of changemakers and problem solvers, making an impact across the world. You are ambassadors of the Manaaki Scholarship Program and your relationship between your country and New Zealand. We know the future of both rests safe in your hands. I will leave you with two final calls to action. Firstly, you each represent the very best of your country, and what you do next matters. You have not only earned an qualification, you've gained new perspectives, connections, and tools. Use these to inspire others and help shape a better future for us all. Secondly, your relationship with New Zealand doesn't end here. Manaaki scholarships aim to foster a lifetime connection between New Zealand and you, the leaders of tomorrow. You are now a part of our international family, so let's stay in touch. Follow the New Zealand Embassy or High Commission accredited to your country on social media. These New Zealand posts will help you connect with each other and keep you informed of events, activities, and opportunities for Manaaki alumni. Thank you for welcoming me here today. Congratulations on your accomplishments and all the very best for your journey ahead. Ka kite anō.
Ngā mihi nui, Ruby. Thank you very much. Just checking you can see the PowerPoint. Yes?
Yes.
Thank you. Okay, so as I said, we will now sing a waiata. Please feel free to join in so that I'm not singing by myself. Okay, hopefully the sound will work.
행하이 위에 하이레마이 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 행하이 위에 하이레마이 이루마오 테마라이 루이마이 Top 5, Bano. Okay, it is now my great pleasure to start presenting the certificates. So feel free to clap or wave or use your emojis as your wonderful colleagues are presented with their certificates. And Chris will read the names. Thank you, Chris. So first.
Kia ora. Oh, okay. With the order is slightly different. That's absolutely fine. To Yusma Jeffrin Dato Muhammad Yusuf, congratulations.
Thank you.
Next, Sharifa Ko Kaixing. Congratulations on completing this course. Wonderful to have you on board. Kiorina, congratulations to you too. Thank you for your participation.
Thank you.
Prum Polim. Prum, well done. Thank you so much for taking part.
Kia ora, thank you.
Kia ora, nice. You've been a very outspoken person, so well done. Adezayu Kimpaka Sari Roslan, and you'll forgive my pronunciation, but I'm trying my hardest to get this right. But well done.
Congratulations.
Congratulations. Kia ora, yes, everybody. Aldidia Waisati Pratama. Congratulations to you, Aldidia. And Anida Falahaini, congratulations for your participation and completion.
Thank you
Lots
very
of
much.
love and hearts and claps coming through on the screen. Diana Rahima, well done. Thank you so much. Lovely to have you involved and engaged. In fact, that goes for everybody. You've been so engaged in this course. Nurul Ilma, congratulations to Nurul.
Thank you very much.
You're very welcome, Nurul. And Prita Sari Mustika Dewey. Prita,
Thank you.
well done. It's been great. We've engaged online and offline, in the course as well. So very engaged student. Thank you for your involvement and participation, Prita. And Rizki Amanullah, congratulations to you too.
Thank you. Thank you very much.
You're very welcome. Yuli Dwi Haryani. Congratulations, Yuli. Thank you so much for your involvement.
Thank you so much.
Suthida Villeviang. Suthida, Thank you very much for your participation and active engagement throughout the program.
Thank you very much.
Oh, lots of claps coming through. Fun on fun. Sitikse, have I got that right? I'm not sure, but fun on fun. I hope I've got that near enough to the correct pronunciation. Thank you so much for being
Thank you
involved
so
and
much.
joining with us.
Thank you so much.
You're welcome. And Darwin, Rosina Shah bin Iskandar Shah Parameswaran. I think you get the prize for the longest name today. Congratulations.
Congratulations.
And Sapal Phew, one of our, I think, Myanmar students. So they've been quite a group this time. So well done. Against a lot of challenges. It's wonderful to have you all from Myanmar participating this time round. And we know how challenging it can be at the moment. Chan Yen Ong. Chan Yen Ong from Myanmar. Fantastic to have
Thank you,
you.
Chris.
Very welcome.
Thank you.
And Pon Piaison, you've been very keen and engaged all the way through. So it's been wonderful. And we recognize how busy many of you are with your day jobs. So it's impressive the way you connect. So thank you.
Thank you very much.
Next, Tan Tun U. Tan, thank you. Lovely to have you on board. And thank you for your contributions to the course. Congratulations.
Thank you, Chris.
And Joan Calamontero, I think we're now moving to the Philippines. I detect a change in names. So I think the Filipino contingent have done very well and been very active as well as the others. So it's been great to have so many from that part of ASEAN. Thank you and congratulations, Joan. And Jennifer Patinio, congratulations. Wonderful to have you taking part.
Thank you so much.
You're very welcome. Risa Antero Serna. Not sure if I've got that right, but I think it's Serna. Yeah.
Thank you so much.
Risa, well done. Thank you, Risa.
Thank you.
And Nino Achisaison Labordo.
Thank you so much.
Congratulations. Thank you. Another very engaged
Congratulations.
student.
Thank you.
Congratulations. Apinya Niramitsan Tipong.
Thank you, sir.
Well done, Apinya. Thank you. And Tran Thi Huang Tra. I think we're now moving towards Vietnam. And then congratulations to Tran Nguyen Thi Ngoc Han. Nguyen, congratulations. And Thi Ngoc Han. And then the next one, Nguyen Thi Phuong Han.
Thank you so much.
Congratulations to you. And again, we've had a wonderful contingent from Vietnam this time around. It's been great to have you all taking part. And next, Nguyen Thi Chuit Nan.
Thank you so much.
You're very welcome. Congratulations. Nguyen Thi Thuong.
Thank you very much.
You're very welcome. Congratulations to you. I think we must be just about. Oh, Tran Trong Tan. Tran
Yeah,
Trong
thank you
Tan.
so much. Yeah,
Thank
of
you.
course.
Thank you
Yeah.
very much. And everyone's been so active and involvement. It's really been very much of a shared learning opportunity. And
That was the
that
last
is it.
one.
Wow. Okay. So
Kia
amazing.
ora, Chris. Thank you. Congratulations to you all. You will receive the hard copy of that certificate in due course from the MFAT post in your region, along with a Manaki pin that you may wear with pride to prove that you are one of our Manaki whānau. So I would now like to open the floor to you wonderful scholars, if any of you would like to say anything.
Yes.
Yes?
regions, health, security, supplements, professor expertise as equipment, which was for real world impact. And our thank during this last week as Vietnamese today, November 20th, and support. Thank you for this tech support and the general living allows us allowed for enrichment. We are strong with the health and thanks also. Thank you.
Thank you. I think you broke up a little bit, but I think we caught most of it. Thank you very much. And I think really the real world impact, yes. Yes, that is as Ruby said, you know, you are very special and you do have that capacity to make real world impact for your communities. Thank you, Huang. Anyone else? Nino, did you unmute yourself? Yeah.
Thank you so much for all. On behalf of my agency, the National Nutrition Council here in the Philippines, I am so grateful and thankful for all the opportunities that you have provided, especially to the New Zealand government for this opportunity. It has been a while that I have no means of learning outside, but this is one of the best. Even if it's an online mode of our learning, but it has given a lot of opportunity, particularly of knowing the real essence of our public service and knowing that this will help a lot in our communities, particularly at the rural areas of the Philippines in Mindanao area. And I hope that you can still give chance to other and give opportunity to other, particularly those who are healthcare providers in the Philippines. I would like to thank our professors, particularly for their brilliant ideas and sharing, and of course experiences that we have already put into our hearts and mind, and would like to also extend our appreciations to the facilitators, the moderators, and all who are in one way or another helping us guide and build our confidence in helping our community and building our skills and knowledge in public health management. And for the University of Auckland Public Policy Institute, the staff and all of those who helped us, please extend our regards, and we hope to visit New Zealand soon and eventually see our professors. And to all my classmates who are very active, we hope to see each other, and we hope to have an alumni of our different countries in Asia. And we need to continuously sustain our efforts in terms of helping each other. And I know that when we do our best together, we come together, we can do better in terms of health and policies and implementations. Mabuhay tayong lahat, and God bless. Congratulations to all.
Kia ora, Nino. Thank you very much. Yes, I hope that this is a network that sustains all of you, that provides you with support and opportunities across your region. And yes, if you are down in our neck of the woods, if you're down near Aotearoa, New Zealand, please, we would love to see you in person.
Soon.
Soon, yes. Yes, please. Is there anyone else that would like to say anything?
Can I just say a word here now, Suzanne? Is that all right?
Yes, yes, of
Just
course, Chris.
I just wanted to acknowledge the wonderful teaching team that I've been able to work with these last 5 weeks, acknowledging PP, Dilla, Monica, Poot, and Nawa, and also Professor Sir Colin Tukuitonga, who spoke to you yesterday, who I think was outstanding. And so acknowledging all the hard work and effort they've put into preparation and supporting you. But also, you know, you are an exceptional group who have engaged really well, despite it all being online. It's one thing to be a captive audience in a classroom. It's another thing to be online and sitting in front of a computer for 3 hours, two sessions a week for 5 weeks. And yet here you all are. So I just take my hat. If I had a hat on, I'd take it off for you. And I'm very impressed, and I am confident that you will continue to be effective change makers in your country and in your region to improve the health of all our people. So thank you for the privilege of supporting you in your learning journey. And the material on Canvas is still available to you for a period of time. And some of the other groups in the past have formed WhatsApp groups to keep in touch and share information and so forth. So maybe that's something some of you might like to consider. Anyway, mā te wā.
Kia ora, Chris. Anyone else would like to say anything? Perhaps the rest of the teaching team, PP?
Kia ora, Suzanne. Kia ora, everyone. Yeah, it's always been a great pleasure to work with Manaki Scholar, who are not just outstanding, but also like have very strong experience. And oftentimes I feel like we are like sharing each other rather than like teaching or facilitating the session. So yeah, sometimes we are too much immersed into our area. So whenever I heard about different perspective, I'm like, wow. So I'm really amazed by your outstanding achievement, your thoughts on the public health, and also commitment, and also a lot of expertise and knowledge that you bring. So I really enjoy working with you over this past few weeks. And also thank you very much to Suzanne, Gay, and also Juanita and Louis for the amazing help like throughout the sessions. So without you, we would not have done it. Yeah. Over to you, Susan. Kia ora.
Kia ora, PP. Monica?
Okay, thank you, Suzanne. Yeah, I just want to thank you, everyone. Thank you for all the participants. And also thank you, Suzanne, Juanita, Gay, Luis, and thank you so much for helping us. And especially thank you for Chris and PP, especially for PP who asked me to join this team. It's such a great team. Thank you also for Put, Dila, Noah, and yeah, once again for the participant. I know working in public health sector in your countries mean heavy workload. So thank you for your dedication in this training, and just don't forget to take care of yourself. So once again, congratulations. Thank you.
Kia ora, Monica. Dilla?
Kia ora, everyone. I would like to thank, first of all, Chris for this beautiful opportunity. He brought me in. This is my first time teaching this course. And thank you, PP, Monica, Food. Thank you, Food, for helping me the other day with my technical issue. Yeah, thank you, Suzanne and Gay and everyone who was involved in the teaching. I really enjoy teaching, and I really enjoy coaching and mentoring. And I would love to take this as a career in the future. So this was a great opportunity for me. So thank you, everyone. But also thank you for the students. As PP said, it was an interactive, they were interactive classes, and we learned a lot from your experiences, from your thoughts. Some of you are very well known, like Nino, for example, and Rizky Amanullah. Yeah. So it was a great opportunity. Thank you so much, all. And as they said before, take care. Public health is it's ongoing, and I hope you contribute positively to your community, to your nation, and to the world. Thank you so much.
Kia ora, Dilla. Poot, you're here?
Kia ora.
Kia
Yes,
ora.
I would like to say thank you very much and appreciate Manaki New Zealand scholarships. Yeah, and especially for New Zealand Ministry of Foreign Affairs and Trade. Yeah, I am myself two-time Manaki scholar. So from my previous master and now current my PhD. So I am also Manaki scholar as well. And it's very happy to see this program to support the opportunity for ASEAN country and other, and I know many countries around the world. So there's so many great scholarships from the New Zealand. Yes, and I would like everyone here, our participant, to keep uh, apply because every year and a lots of scholarships from Manaki team provide to our country, and if you are interested in continue, so it's a great opportunity for you to improve your knowledge in terms of public health management or other field that relate to health system. Yeah, that's a great opportunity. And in this time, we'd like to thank Professor Chris, and our team members, and also our facilitator team in Auckland, Public Policy Institute, and also in Wellington. Yeah, thank you very much for this opportunity. I learned a lot from the participants, so not just only myself to be a facilitator, but we learn together, and then I hope that these connections and collaborations in the future as well. Thank you. Kia ora.
Kia ora. Sam and Emily, would you like to jump in here and say a few words?
Yeah, kia ora everyone, and
Kia ora.
congratulations to all of you. This is a significant achievement, and your commitment to learning and improving health systems will make a real difference in your communities and your countries. We're proud of your hard work and resilience, and we look forward to hearing about your impact that you'll make in the future. Well done.
Kia ora.
Kia ora, everybody. Yeah, a huge congratulations from us and our team. We're proud to have been just a small part of your journey on this course. And I think it's been mentioned a few times, but I think the power and the beauty of the Manaki program is that not only it creates those connections with New Zealand, but also across your region. You've now got 29 other people that you can call when you need to and ask for advice or share your knowledge. And I think, yeah, that's a really powerful part of the program, is just the strength and the connections. So well done to you all. I know some of you have faced a lot of challenges over the last few weeks with work commitments and family commitments and typhoons. So well done for seeing it through. It's really, really impressive. So well done. And yeah, we look forward to hopefully seeing some of you in New Zealand one day.
Kia ora, Emily. Yes, namihinui. Thank you both. I want to acknowledge, thank you, all of the lovely comments that you have been putting in the chat as well. We are, yeah, very, very appreciative of all of your lovely, generous feedback about the course and what you've gained from it. So before we do our waiata, I wanted to make sure that I hadn't left anyone out who wanted to say, well, no, actually, we're not going to do a waiata, we're going to do our team. But before we close with our PPI team, is there anyone else who wanted to say anything? I'd hate to think I didn't give you a chance. Okay. No? 5, 4, 3, 2, 1. Okay. All right. Well, I would like to hand over now to my wonderful colleague, Gay, to say a few words. Gay, e hoa.
Thank you, Suzanne. And congratulations, everybody. And it's been a pleasure to support you in this last 5 weeks. Time flies. And I apologize if I have sent you multiple emails at the beginning, but it was for your good so that you can get access immediately to the wonderful materials that our teaching team has prepared for all of you. And as mentioned by Chris, that would be made available for you for 2 months after this date. So please make sure that you get the materials that you need within the time, because I'm sure that they will be very helpful for your jobs. And I really appreciate all of you when you message me. Like if you, those of you like your attendance is really amazing. Like we really salute, especially those people who face challenges because of the weather disturbances and they still decided to attend the class. It's really amazing, your commitment to this course, and those who have work commitments, those who had family commitments, even health commitments or concerns, but still decided to still participate actively in the discussion. So thank you so much. We learned so much from you. And as a fellow Manaki scholar and Southeast Asian, I'm really so proud. And I know that we have a good, very good people in all of our countries supporting our public health system. So again, congratulations to all of you. And I now hand you over to Juanita.
Kia ora, everyone. Congratulations for succeeding in the course. I am always behind the scenes, but listening to your conversations, your discussions, your participation, and it is really an honor to be part of the team supporting in any way possible. So yes, I just wanted to say all the best for your journey, and hopefully you can keep making a special contribution in your countries. And it has been a pleasure to be here learning from you all. Thank you. Kia ora, Sus.
Kia ora, Juanita. Louise?
Hello, everyone. Congratulations on your achievements. And I would also like to commend the teaching team for your wonderful teaching, no, and sharing. And I learned a lot from you as well. So congratulations, Kia ora.
Kia ora, Louise. Okay, so we now will celebrate with a waiata, another waiata. This one is kind of the unofficial, no, it's not official. It's the unofficial national anthem of Aotearoa, New Zealand. So if you come here, which I am really hoping you will, everyone will expect you to know this song and join in. Okay. Okay, where's my play button?
Tira mai wi, tato tato we. Tira mai wi, tato tato we. Baya te maramatanga, me te aroha ena iwi, kia kotaki, kia kotahira. Tato tato we, tira mai wi, tate tato we, tira mai wi, tato tato we, baya te maramatanga, me te aroha e ngai wi, kia kotaki, kia kotahira, tato tato we, tato tato we,
Here we. Ka pai whānau. Nope. Okay. So I would just like to say again, congratulations on behalf of the team at the Public Policy Institute on the completion of this module on public health management. On behalf of you, the scholars, I would also like to thank the various professors who have shared their knowledge and time and insights with you. And of course, to our wonderful team of support people, Gay, Juanita, Louise, we couldn't do without you. And of course, you have also, with family in the Philippines, faced significant challenges and still turned up. So respect to your commitment. We appreciate you. And yes, we love you all. We couldn't do it without you. Learning, communicating, and networking across regions, cultures, and in different languages online is a massive challenge, especially with some of the severe events of the last few weeks. But it is a challenge that you have risen to and achieved with spectacular success. We are incredibly proud of you and privileged to know you. That being said, on a more positive note, because we live in a digital world, the new technologies enable us to cross borders and connect with each other in ways that we couldn't have imagined 30 years ago. So, from all of us at the Public Policy Institute, please keep in touch. Thank you so much for your participation, for your enthusiasm, for gifting us your time and your knowledge. We look forward very much to hearing about your achievements via LinkedIn or through email in the future. Whatever forum, I have no doubt that you will achieve enormous real world impact, and we will be incredibly proud to say that we know you. So now it is time for a group photo. I think because there are a lot of us, I am going to take two. So I'll count us down and take the first one, and then I'll shift my screen and take a second one, okay? Okay, 3, 2, 1. Oh, no. Where did it go? Sorry, I lost it. Oh dear. Nope, I found you. I don't know what it's doing. Where have you gone? Might just stop screen sharing for a minute. Right. Stop sharing. Sorry. There we go. Now I can see you properly. Sorry, the screen shared was not happy. Okay, sorry. Again, for the first lot. 3, 2, 1. A bit slow. Okay. Okay. And I would just save that. Sorry. The computer's not being very cooperative right now. Come on. Oh, seems to have frozen. That's not helpful. Okay. Why have you frozen? You annoying me. Okay. All right. There we go. All right. And the next one. 3, 2, 1. Okay. Excellent. Thank you very, very much. It has been such a joy to know you all. And please, as I say, please stay in touch. And we look forward to hearing from you soon. So go well. This isn't goodbye. This is ka kite anō until we see you again.
Ka kite anō.
Akite. Thank you very much.
Thank you all. Take care.
Thanks a lot.
Thank you,
Thank
Professor.
you.
Thank you, Chris, so
Bye-bye.
much.
Yeah.
Yes, thank you so much, Professor.
Thank you so much. Bye-bye. See you.
Bye-bye.
Bye.
Thank you.
Thank you so much. Bye-bye.
Thank you.
Thanks, team. Thanks, Chris and team.
Oh,
Thank
thank
Hi,
you. Thank
everyone.
you
Thanks for
so
all your
much.
greetings.
Yes.
Yeah, it's been great. It's been another good
Thanks, Emily and Sam. You're still
Thank
there.
you, Chris. Thank you, team.
Thank you so much, everyone. Take care.
Take
You too.
care.
Bye. Keep
Daghang
safe and well.
salamat.
Salamat.
Happy
birthday, Dadaki.
Happy birthday.
Terima kasih. Thank you.
Thanks, team.
Thank
Going
you.
now.
Yes.
You.
Lots of love.